Hi, James. Thank you for coming in and meeting with me today. I also appreciate your parents being here and sharing their concerns. Based on the symptoms you've experienced over the past 8 weeks, I would like to ask you some additional questions and discuss a possible diagnosis and treatment options. Have you been hearing or seeing things that other people do not hear or see? The rationale for asking this question is to assess for hallucinations, that is a symptom of schizophrenia spectrum disorders. Do you feel like people are watching you, following you, or trying to harm you? This question is needed to assess for paranoid delusions and suspiciousness because James is already starting to demonstrate that. Have you used alcohol, marijuana, or any other substances recently? The rationale for this question is to determine if substance use might be contributing or worsening the psychotic symptoms. How has your mood, motivation, and interest in activities changed recently? This would be used to evaluate the negative symptoms like lack of motivation, social withdrawal, and a reduced emotional expression. Another one would be, is there a family history of schizophrenia, bipolar disorder, or any other mental health conditions? This would help to identify genetic and familial risk factors that are associated with psychotic disorders. There are many appropriate screening tools that can be used to evaluate James. The positive and negative syndrome scale, that helps to assess the severity of the positive symptoms like hallucinations, delusions, and the negative symptoms like social withdrawal. Another scale that could be used is the brief psychiatric rating scale, which evaluates psychotic symptoms, mood disturbances, and overall psychiatric functioning. Another useful one could be a toxology screening to see if it causes the substance-induced psychosis. There are many differential diagnoses. Schizophrenia disorder, because James has the psychotic symptoms, they've been lasted longer than 1 month but in less than 6 months. Major depressive disorder with psychotic features. This is because of the depressive symptoms and they're prominent with the psychosis. Substance-induced psychotic disorder, because marijuana and other substances can trigger psychotic symptoms in young adults. For pharmacological treatment, an atypical antipsychotic like risperidone could be used because it can help to reduce the hallucinations, the paranoia, and the disorganized thinking. Another atypical antipsychotic is Abilify. It has a lower risk of certain side effects, and it can improve the positive and the negative symptoms of schizophrenia. Psychotherapy is also very important. One option is cognitive behavioral therapy for psychosis. This helps patients identify the distorted thoughts and develop coping strategies for hallucinations or delusions. We would need to collaborate with other health care professionals. This includes working with psychiatrists, primary care providers, therapists, social workers, and case managers, and even coordinating if he is in school with the school counselors or the vocational rehab services, because they can help him to make sure that he stays on track academically and improve some of the occupational functioning. Also, community health programs and family support services can help to improve for long-term outcomes and reduce possible relapse. For early onset schizophrenia, the case is different because with the earlier, it happens before the age of 18. With a more gradual onset and of a severe impairment in social, academic, and developmental functioning, younger patients show developmental delays, poor peer relationships, and behavioral problems earlier in childhood. So for this situation, James is 22 years old, and it seems like he has developed the symptoms during young adulthood, which is more that common age of the onset schizophrenia spectrum disorders.